Okay. Okay. Okay, let me see here. Okay. So this week we're talking specifically about infant, toddlers, and preschoolers. Okay, so it's chapter 31, 32, and 33. Okay, so starting with infants, but this applies to growth and development overall to all kiddos. Development and growth is most dramatic during infancy. That's where they're having the most changes. The specific body system that is the most is growing the most quickly is the central nervous system. Okay, so the brain is making all those pathways, and then also the spinal column. Okay, and the spinal cord. So if infants specifically, if they're growing up in poor environments, so they're not getting the nutrition that they need, or they're not being cared for by their parents like they should be, then their development is going to be affected. Okay, so they're not going to grow as well, and they're going to likely have developmental delays. Okay. Infants, they should be gaining about 5 to 8 ounces a week. Okay, some gain more, some gain a little bit less, but on average 5 to 7 ounces a week. They should double their birth weight by 6 months and triple their birth weight by a year, and their height should increase 1 inch a month for the first 6 months. Okay. Growth in infancy is in spurts versus kind of, a gradual pattern like when kids get older over the age of 2. Okay. As they grow and get older, their heart rate is going to slow down, their respiratory rate is going to slow down as they transition from in utero to extra utero life. Okay. Their hemoglobin is going to decrease around 3 to 6 months of age. Okay, you'll see anemia because they're losing that fetal hemoglobin that they had while they were in utero. Okay. Iron is from mom until about 5 to 6 months of age, and then that's where you see that fetal hemoglobin weans off. So then kids a lot of times will have anemia around 6 months. Okay. Head growth is very rapid the first 6 months. The posterior fontanelle, so the posterior soft spot, okay, that stays open until about 2 months of age or 8 weeks. And then the anterior soft spot or fontanelle closes between 1 and 1.5 years. So 12 to 18 months. Okay. And then these kiddos each week and each month, their vision and their hearing is getting better. Their immunologic system for the first 6 months, they're getting their protection from mom, okay, maternal antibodies, especially if they're breastfeeding for the first 6 months. If they're not breastfeeding, then usually those antibodies still last about 4 to 6 months. Okay. Their immune system kind of fine tunes itself over the first year. Usually by 6 to 8 weeks, their antigen antibody response in their immune system is mature enough that they can actually start to form antibodies from their vaccines. So that's why we typically wait until about 2 months of age to do most of their vaccinations. We do that Hep B vaccine at birth because actually about 50% of moms don't even realize that they have hepatitis B, and it can be contracted during delivery. That's the risk there. So that's why we do that at birth. By 12 months, they're totally on their own for their immunity. Okay. IgA is along the GI tract, and it's immunoglobulin A. Okay, so that's what's helping their immune system drive in their GI tract. Vernix cacosia, that's what is that kind of cheese, cottage cheese kind of in the crevices. It's in the skin folds. It helps to prevent their skin from getting infections when they're newborns, okay? Thermoregulation, they need to be dried right after birth and placed under a heat lamp because they cannot regulate their own temperature right after birth, okay? With each hour that that baby's alive, they become more efficient at regulating their temperature, okay? Babies can actually shiver. So if you notice a baby shivering, usually they're very, very cold. So make sure you're bundling them up and you have them under a good warmer. Either that or skin to skin with mom or dad is helpful too. During the first 6 months, they increase their fat tissue, okay? And that helps to regulate their temperature as well. After birth, okay, there's a shift that happens from the water goes from intracellular to extracellular, okay? And that then predisposes these kids to more likely to have dehydration, okay? It's a major shock on the body to be delivered. Okay, fine motor development. So there is a really good handout in week 2 that has gross and fine motor kind of developmental ages and list a bunch of the developmental milestones there. So I would refer you guys to that to make sure that you're aware and knowledgeable about all of the milestones. Those will be on the exam and also the quiz next week. Okay. So prehension, that's just kind of generally grasping objects. That's using their entire, hand to grab those objects. That usually happens about 2 to 3 months. Okay. They can't grab that object and, grab their passy and put it in their mouth yet. They're just kind of grabbing. Okay. And you'll see that happen. It's kind of a reflex where babies will grab parents' hands, shortly after birth, and that's a reflex, grab their finger, and they, then squeeze their finger. Transferring objects between hands, that happens around 7 months. Palmar grasp, that's going to be a little bit more of a fine grab than the prehension. So that usually happens around, I would say 4 to 6 months. Is kind of just the general, they can scoop that up and hold on to it more purposefully than with prehension. Pincer grasp, so that's using their pointer finger and their thumb to grab an object. That usually should happen by about 10 months of age. Can start around 8 to 9 months. That's where you can see those babies are eating like those little yogurt melts or the little puff cereals that they can grab really well and put straight to their mouth. You'll usually see those being available around 9 months of age. Taking objects out of a container, that usually happens around 11 months, and building a 2-block tower by a year. Okay. All right. So what are these answers again? We just talked about them. What age for Palmar grasp?
4 to 6 months.
What about transferring objects, one hand to the other?
7 months. 7 months.
Yep, 7 months. Okay, pincer grasp, that really fine grabbing.
10 months.
10 months, 9 to 10 months. Yep. Removing an object from a container, taking them out.
11 months.
Yep, and then building 2-block towers.
A year.
12 months. Yep, a year, 12 months. Good. All right. Gross motor development. So head control. That's one of the first things that should be happening, okay? Babies, for the first couple of weeks, a lot of them have that tonic neck reflex. So it'll look like they're really good at controlling their heads for a few seconds, and then all of a sudden they kind of lose their head control and become like a little bobblehead. That is a reflex, okay? Now, actual head control, you can kind of see in this picture, when they're 2 months, their head control isn't going to be that great. If you lift them up by the arms, their head will kind of lag back. That's called head lag. Now, as they get closer to 3 months, their head, they'll be able to kind of hold their head up better as they're getting ready to the sitting position. Then by, 4 months, they should no longer have head lag. So their body should, their head and their body should be all in line as they're sitting up, okay? Rolling over, belly to back should happen by 5 months of age, and back to belly by 6 months of age. Okay, so they should be rolling both directions by 6 months. Sitting independently should be 8 months of age. Okay. To move from their belly to sitting, they should be doing that by 10 months. Okay. And these are all, the latest times that they should be doing these things. There's kind of variation with each baby. Okay. Cephalocaudal direction of development. So that means head to tail development. Okay. So cephalo is head and caudal is tail. So head to feet. Okay. Crawling should happen between 6 to 7 months. Okay. Creeping, which is walking kind of along objects, that's usually by 9 months of age. Walking with assistance, so you're holding baby's hand, that's usually by 11 months. And then walking by themselves is a year. Okay, nutrition over the first 6 months. The first 6 months should be formula or breast milk. Okay. That's the only thing babies should get for the first 6 months. Now, it used to be that some providers would tell parents that they could start baby foods, around 4 months. They've gone away from that. The AAP has. They recommend no baby foods until 6 months of age. Okay. Now, breastfeeding is recommended for at least the first 6 months. And then ideally until the age 1, but that's not always able to be accomplished. So as long as the baby's fed milk or formula until a year of age, then that's okay too. Okay. Babies should eat on demand, it doesn't matter if they're breastfed or pumping and bottling or formula fed. Okay, they should be eating on demand. Okay, 10% weight loss, up to a 10% weight loss after birth is normal. Baby should be back up to birth weight by 2 weeks of age. Okay. First day of life, baby may only have 1 diaper. They should have 1 wet diaper per day of age old they are until about 5 to 6 days, and then they should be having 6 to 8 wet diapers a day. So if they're 2 days old, they have to have at least 2 wet diapers, 3 days old, 3, 4, and so on until about 6 days of age. Then from 6 days of age on, they should be having 6 to 8 wet diapers a day. Okay. Making sure that they're having those good meconium stools their first couple days of life, and then that should transition to, more of a green kind of yellow color of stool. Breastfed babies need to be on vitamin D supplementation, 400 international units a day, or 10 micrograms. Okay. ½ ounce per day for the first 2 months of life for weight gain. Okay, this is what baby's poop should look like after they have transitioned from meconium. Meconium stools, they're going to be those black kind of tarry, really sticky, hard to get off of their bottoms stools right at first. Okay. And as their digestive system matures, then that's where you start to get more of the yellow kind of green colored stools. Okay. And then their liver is the most immature. That's why you get kind of this greenish yellow color. Okay, so the liver takes them the longest to mature. Okay, second 6 months. So at 6 months of age, then is when you can start introducing solid foods. That can be either puree foods, you can do baby-led weaning, okay, all of that. So on this picture, it says no veggies, but, or non-veggies as in meats. Babies can have meats starting at 6 months, okay? That's also kind of changed recently, okay? They obviously have to be in strips so babies can eat them and not risk choking, okay? So with introducing solid foods, making sure babies are getting those high allergen foods too early on. So things like fish, dairy, peanuts, tree nuts, all of that should be fairly early on, starting at 6 months. Because the earlier you introduce those things, the less likely they are to have allergies to them later in life, okay? Of course, you can't give babies peanuts. You have to give them, you know, like powdered peanut butter that's watered down with breast milk or formula. Okay. Babies should still be taking at 6 months of age all of their breast milk that they were previously or their formula. Okay. Usually only 1 meal a day around 6 months, and then starting at 7 or 8 months, they can have 2 meals a day. And then by 8 to 9 months, they should be having 3 meals a day. Okay. And then slowly the amount that they're taking in of breast milk or formula should start reducing. Okay. No whole milk until a year. Okay. And then no honey until after a year. What's the risk with honey if kids have honey before age 1?
I think it's allergic reaction
Mm,
or botulism.
botulism. There you go. Botulism is the risk for honey before age 1. Okay. Good. All right. So food sensitivities, like I talked about, doing those high allergen foods. There's 9 of them earlier. And then making sure parents are monitoring those kiddos for food allergy reactions. So anaphylaxis. Okay. And you want to only do 1 high allergen food alone by itself a day. Okay. So eczema goes along with allergies. So if kids have seasonal allergies or food allergies, or they have asthma, if they have either of those things, they're more at risk for eczema. And if they have eczema, then they're also more at risk for developing asthma and allergies, as in environmental or food allergies, okay? Allergies, food allergies are when they have anaphylaxis, okay? Now, intolerances are when you see like GI upset or rashes that aren't hives, okay? That would be an intolerance versus a true allergy, okay? They do now have desensitization. So if kids have, so for example, probably the most common one is peanut allergy, right? So now, as long as their risk for anaphylaxis isn't too elevated, then what happens is they go to an allergist office and they get a tiny amount of peanut butter. And then the allergist sits and they watch them for 15 or 20 minutes, and then they give them a little bit more and then they continue watching them. This lasts about 2 hours. And then they kind of keep an eye on them. If they don't have any signs of an allergic reaction, then they are then considered desensitized, and they are encouraged to then regularly do peanut butter. Okay, or whatever their allergy is. Okay. The thing is with allergies, specifically food, making sure that they're eating those things regularly, at least once or maybe even twice a week, to make sure that they then don't develop an allergen from not having it often enough. Okay. Like I said, if the allergy is significant enough and they have anaphylaxis from that food, then they are needing to avoid the food, and they need to have an EpiPen on them at all times, or on their parent. Whoever's with them needs to have an EpiPen at all times. Okay. There is skin testing for allergens, but usually for food allergies, it's blood testing that is done. They look at the immunoglobulins, okay? So the IgE is usually what they look for food allergens. So if that number is really, really high when they do the blood test, then they won't even attempt desensitization. They just tell parents to avoid it, okay? Obviously, if the kiddo's having anaphylaxis, they need to go to the, if they have epi, they need to give themselves or have the parent give themselves their epi injection or their intranasal epi, okay? And then they need to go straight to the emergency room or call the ambulance. Okay, sleep and activity. Sleep patterns vary drastically among infants. Usually by 3 to 4 months of age, they should be able to sleep 9 to 11 hours at night. Now, do all babies do that? No. Some babies continue to have frequent wakes, waking up, even up until age 2. So, but they can physiologically do it by 3 to 4 months of age. Okay. Breastfed babies, they're going to typically wake up more often because the breast milk doesn't tide them over quite as long as formula does. Okay. They will start with more frequent napping as, newborns, and then those naps will become fewer and further between. They'll usually sync up to a couple, maybe 1 to 2 hour naps a day by, 3, 4, 5 months old. And then from there on, they'll kind of phase out to 1 nap closer to, 1.5 years to 2. And then after that, sometimes 2 to 3, they kind of no longer decide that they need to be taking naps. Okay. Walkers, swings, playpens, the jumpers, those are all no longer recommended by the American Academy of Pediatrics. There's a lot of, first off, risks for injury with those things. And then also developmental, like hip developmental dysplasia because of how the kiddos' hips are, or some of them encourage toe walking because the babies can't be flat-footed, when they're in the walkers. And then that's just kind of a lot of pressure on their little hips, just kind of dangling there. Okay, so those are no longer recommended. Dental health. So it's important that mom has really good dental health while baby's in utero. That makes a huge difference in then baby's dental health. Cleanings, usually those start around the time that primary teeth are repped, which for the most part, that can be anywhere between 6 months to a year. For sure, though, they should have a dental visit by a year of age is what's recommended. Fluoride can start at 6 months. Okay. Reducing your risk of dental caries or cavities is making sure that parents aren't propping the bottle up so that milk is just sitting on their teeth after, they get teeth. Encouraging parents to not give them milk while, like in nighttime, they're going to drink a huge bottle and then go right to bed. That's the perfect storm for dental cavities. And then fruit juices early in life are also not a good thing to do. Pacifier use, if kiddos do not get rid of their pacifier by age 2, for sure by age 3, then there can be effects then on their dentition, and they are more likely to then need braces. Okay. You should figure out how many teeth a kiddo should have by age 2, or through 2 years of age by looking at that kiddo's age and month and then subtracting the number 6. Okay, so 8 months minus 6, babies should have 2 teeth at 8 months of age. Okay, about. Some babies have 4 teeth, some babies have no teeth at 8 months. So there's kind of some give and take, but when you look at kiddos age and months up to age 2 and subtract 6, that should tell you about how many teeth they should have. Okay, vaccinations. There are a variety of vaccinations that are given. The schedules are all not necessarily all a little bit different because it's a consistent, we consistently do the same vaccine, the same bacteria coverage and viral coverages in each vaccine. However, depending on the manufacturer, their combination vaccines might be a little bit different. Okay. So like I said, the first vaccine that babies get are the hepatitis B vaccine. That's while they're in hospital shortly after birth. Okay. And then they get the same vaccines at 2 months, 4 months, and 6 months of age. And that includes hepatitis B, diphtheria, tetanus, pertussis, polio, Haemophilus influenza B, and pneumococcal. Okay. Also, those are all vaccines. Now, like I said, they're in combination. So usually now most kids get 2 pokes and a drink vaccine. The drink vaccine is for rotavirus, which is a GI bug. Okay. So they'll get all of those vaccines at 2 months, 4 months, and 6 months. At 6 months, kids can start getting flu vaccines, so influenza. Okay. And then starting between, so at the 9-month visit, usually most babies do not get any vaccines. Okay. And then the next visit after that is the 12-month visit. Babies will usually get their hepatitis A, their MMR, so measles, mumps, rubella, their last dose of Hib, so Haemophilus influenza B. Okay. Now there's some kind of wiggle room on this. So some babies might get chicken pox at 12 months too. Okay. So whatever they don't get at 12 months, then they'll get at 15 months. So then they'll get their chicken pox vaccine, their last dose of their pneumonia vaccine, and then their last baby dose of the DTaP. Okay. So that has diphtheria, tetanus, pertussis. Okay. Then their next checkup's at 18 months. They'll get their second dose of hepatitis A. And then from there, the next time they'll get routine vaccines will be when they're either 4 years of age or 5 years of age, before they go to kindergarten. And before they go to kindergarten, they'll get DTaP, which is diphtheria, tetanus, pertussis, plus polio, all in one. And then they'll get MMR and varicella in one, so MMR V. And like I said, that's between ages 4 to 5. Okay. And then they'll go a really long time without routine vaccines until age 11. And at age 11, they'll get their first Tdap. Now you'll probably remember getting that as an adult. So that's tetanus, diphtheria, and pertussis. Now the difference in between DTaP and Tdap is in DTaP, infants' risk for pertussis is a lot higher. So the dose coverage for pertussis is higher in DTaP than it is in Tdap. Okay. So at age 11, they'll get Tdap. They'll get their first HPV vaccine, so human papillomavirus. And then they'll get their first meningococcal virus vaccine. Okay. Which that one covers types A, C, Y, and W. Those are all viral types at age 11, okay? For meningococcal. Okay. 6 months after the first dose of HPV, kids need a second dose of HPV. And then the next time they'll get vaccines after that is when they're 16. And then they'll get 2 meningitis vaccines then. So they'll get the booster of the one that they had at age 11, which, like I said, is the viral strain. So A, C, Y, and W of meningitis. And then the other vaccine that they get at 16 is meningitis B, which is bacterial meningitis coverage. Okay. And then 6 months after they get their first meningitis B, they'll get their second meningitis B. And then that's their childhood vaccines. Okay. As far as influenza, that's recommended every year. The first time babies get influenza, or kids under the age of 9 get influenza vaccine, they have to have 2 doses, 1 month apart. Okay. Any questions on vaccines? I know I kind of threw a lot out at you with vaccines. You won't have to necessarily know the exact schedule, but I want you to know what vaccines kids get. Okay. So this is the list of all the vaccines. And obviously, like I said, the HPV, the meningitis vaccines, those are not given to infants. Okay. So no things like that. Okay. Colicky. So colic is paroxysmal abdominal pain. So these babies have belly pain on and off. It usually starts around 3 to 4 weeks in term infants. Okay. No matter what parents do, they can't get those babies calmed down. They're just really fussy, uncomfortable. About 15 to 40% of infants go through a period of colic. Okay. Sometimes colic progresses to, like, you worry about acid reflux or GERD with kiddos with colic. In that case, you can help by switching them from dairy or removing dairy from mom's diet and doing soy-based formula. Dairy is probably the most common culprit for kids with acid reflux. Okay, so switching them from dairy-based to soy can be helpful, or cutting dairy out of mom's diet can help colic and GERD. Okay, there's really no medications for colic. Sometimes if babies are more gassy, gas drops can be helpful. Sometimes gripe water is helpful. Kind of depends on the baby. But a lot of times you just reassure parents, this will end, this won't be forever. You know, it might be the next couple of weeks, but it should get better. And of course, if parents need a break, they're very overwhelmed with their baby, you know, encourage parents to set baby in their crib where they're safe with no other objects in the crib, and, you know, walk away and take a break. Okay. Also making sure parents are burping baby and setting them up after eating, that can help with colic as well. But like I said, some babies, they can be fed, they can be changed, they can be totally content, everything parents have done, and baby is still just crying. It's okay to walk away after putting them in their crib somewhere where they're safe. Okay. Failure to thrive, growth failure. So this is seen obviously when they're not growing the way that they should. Few different options. Obviously, parents could just either not be mixing formula right, not be providing the baby with feeds, not feeding the baby enough with each feed. There's a lot of different things that go into failure to thrive. So what's really important with kiddo with failure to thrive is you're going to use your entire care team. So the provider is going to be involved, you as a nurse is going to be involved, social work's going to be involved, you know, physical therapy might be involved, all sorts of people will be involved when there's a failure to thrive kiddo. Nutrition, all of that, okay? A lot of times how failure to thrive is diagnosed is that baby will be placed in the hospital, admitted in the hospital. Parents will be feeding baby, you know, like they do at home or based on what's recommended by the provider and the nutritionist to be fed in the hospital setting. And then baby will be weighed naked weights at the same time of day every day to see what they do for weight gain. Of course, if they're not gaining, then there's some reason that they're not gaining. So a lot of times blood work, urine, all of that will be done to make sure that there's not some sort of hypothyroidism or something that was missed. Okay. Overall, most babies, once you figure out what's causing their failure to thrive, babies do pretty well. As long as they're in a loving home where they're getting the care that they need. And if they're not in a loving home where they're getting the care that they need, then DHS or CPS or HHS, whatever it's called in your location, they usually step in and get them in a foster care situation. Positional plagiocephaly. So this is where there's asymmetry of the head. So that's where you see the little helmets kind of utilized. So you'll see wherever they're laying, there'll be a flat spot just because their heads are so, they're not, you know, hardened. Their skulls aren't hardened. So when they're laying constantly on the back of their head, that spot gets flat. And this little helmet helps to kind of round the spot out. Okay. Seborrheic dermatitis is also known as cradle cap. That's pretty common in kids with dairy intolerances. So a lot of times if you cut back on dairy or cut dairy out and transition babes to soy, that will help with cradle cap. So with cradle cap, other than switching them to soy, a lot of times what's helpful is mineral oil or baby oil applied to those little flakes. So kind of soak it in mineral oil or baby oil, let it soak for a while, soft bristle hairbrush, kind of lightly scrub, and then wash with baby shampoo, because otherwise their little hair will be really greasy. And they can do that, you know, 3-4 times a week if they would like to. Parents can. Diaper dermatitis. This is a yeast diaper dermatitis. You can tell it's yeast because it's the kissing lesions. You probably remember reading that in your book. So it's going to kind of mirror each other both sides. And then the other thing about yeast is you'll see these pinpoint little satellite lesions as well. That's the other thing that indicates yeast. For yeast, you'll treat, does anyone remember what we treat yeast with from the book? What babies will get, or from having your own baby with a yeast diaper rash? The same thing that treats thrush. Do you remember?
Nystatin.
Nystatin, good. Yep, exactly. So diaper rash cream, nystatin, okay, or ointment. And then, like I said, thrush is also fungal. So it's oral nystatin for that. Okay, SIDS. So there are some risk factors. So risk factors that increases the risk of sudden infant death syndrome, or SIDS. So being the male gender, certain ethnicity puts you at increased risk for SIDS. So usually SIDS peaks around 2 to 4 months of age. After that, though, it can last until a year for the risk for SIDS. Okay, if parents are smokers, if babies are really hot, if they are on, a soft kind of mattress that they sink into, or they're in a bed with a lot of things in their crib with them, or their bassinet with them, they're sleeping on their bellies. So it's always encouraged to put babies on their back to sleep. Now, once they consistently start rolling, then you still place them on their back, but if they roll to their belly, it's usually okay. Okay. Breastfeeding is a protective factor. So if parents breastfeed, that can be protective. Okay. Being female gender, that's a protective risk factor, or a protective factor and not a risk factor. Okay. Okay. Not being vaccinated or delaying vaccines can also be a risk factor for SIDS. Okay. An ALTI, or an apparent life-threatening event, is a near miss SIDS. So what happens is, they may have a period of time where they have apnea and they stop breathing. And then their body kind of recognizes, or their brain recognizes, oh no, I'm not breathing. And then their brain alerts the rest of their body to then get them to start breathing again. So that's where you see the ALTI. Sometimes seizure disorders can cause ALTIs as well. So figuring out whatever caused that ALTI and then managing from there. So if it was apnea, then they'll get this an apnea monitor. Okay. And this literally just has some electrodes on the skin that senses the breathing. And if they go a period of a certain amount of time between breaths or not breathing, then this apnea alarm will go off, and it will be loud enough. It will kind of startle the child then to start breathing again. Okay. Infant safety, car seat, rear facing until they max out the height and weight of that car seat is what is safest for them. It doesn't matter if they're crisscross applesauce with their legs back there, or they look really cramped. As long as they're under the height and weight of that specific car seat, they should be rear facing. That's the very safest way for them to ride. The biggest risk factor for death in children that's unintentional, especially for infants less than a year of age, are motor vehicle accidents. Okay. Infant CPR, parents knowing how to do CPR, or like the Heimlich, choking kind of prevention, that's really important. So you as a nurse might be teaching parents CPR for infants prior to them being discharged home, making sure that, their home environment is safe, especially as they start to become more mobile. Okay. Babies will climb on things and pull things over, such as bookshelves that you never thought a kiddo could actually pull over on top of themselves. Okay. And then anticipatory guidance is also all a part of that. So teaching parents what they can expect, with each age. Okay. All right. Letitia is a breastfed infant being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Recommend that mother substitute a pacifier for Letitia's thumb, assess Letitia for other signs of sensory deprivation, Reassure the mother that thumb sucking is normal at this age, or suggest that the breastfed mother breastfeeds more often to satisfy the sucking need. You guys can just yell it out. Oops, which is the right answer here? Reassurance. Yep. Yep. Thumb sucking is okay at 6 months of age. Okay. Now, if parents want to substitute a pacifier, that's okay too. Okay. But thumb sucking at 6 months is okay. It's not overly concerning. Okay. Okay. Make sure you guys are reviewing theorists. Okay. We're going to go through, we're going to look at each one. Okay. But make sure you guys really focus on knowing the theorist. You have to just memorize it. However you can memorize it, do that. But you have to know it. Okay. There's also a really good theorist handout from under the week 1 announcements. Okay. Okay, we're going to start with psychosocial developmental theorist is Erickson. Okay. In infancy, it's trust versus mistrust. So infants are learning to trust their parents by crying, and parents figure out, okay, the baby's crying because they're hungry. And then the baby's fed. Okay. They're crying because they need their diaper changed. Parents change their diaper and then baby stops crying. They figure out they're crying and their needs are going to be met. Now, if they're crying for hours and they're not fed and they're not changed and they're not stimulated or interacted with or held or snuggled, then these infants are going to develop mistrust. Okay. Now, when an infant has developed mistrust, then you're going to see they're really all about me. They're biting, they might start hitting. You're going to see a lot of behaviors. Okay. Trust versus mistrust is less than a year of age. Okay. Piaget's. So Piaget is your your cognitive developmental theorist. Okay. Birth to 1 month is going to be use of reflexes. This is the sensory motor phase. Okay. Is your infancy stage. Okay. 1 to 4 months is your primary circular reaction. So between 1 and 4 months, babies might stumble upon their thumb on accident. Thumb in the mouth. They start sucking their thumb. They figure out that on accident. And then they kind of realize, hey, that made me pretty content by being able to suck on my thumb. So then later, a week or so later, then they purposefully put their thumb in their mouth. And then they continue to do that repetitively because they find that that's pleasurable or enjoyable. Okay. Haley, do you have a question?
No, ma'am. I was just trying to get my camera on.
Okay. And then from 4 to 8 months, they have, they're in the secondary circular reactions. So this is where they start gazing, reaching, grasping. They figure out they grab the rattle and then it makes a fun noise and they shake it and they continue to do that, or they start imitating you. So you stick your tongue out, then that baby starts sticking their tongue out. So they start to kind of imitate and play in the secondary circular reactions. Okay. So a schema. So this is where you see the coordination of secondary schemas. So schema is a cognitive framework or a concept that helps organize or interpret information. So over here, so they start by looking at the objects and then grasping or reaching for that object. They can't quite reach it. but then they grab it or grasp it, and then they pick up the rattle. So then that's the operation. So it goes from a schema. So they're gazing, they're reaching, they're grasping, and then they're able to make that operation and pick up that rattle. Okay. Okay. Piaget. So like I said, cognitive development. Okay. Piaget, specifically sensory motor, goes birth to about 18 to 24 months. So the sensory motor phase for Piaget, which is your cognitive theorist, is 18 to 24 months of age, up to that from birth. Okay. Toddlerhood is pre-operational phase. So this goes from 18 to 24 months, so toddler, through early school age, so through about 7 years of age. And then they progress to concrete operational, which is 7 to 11. And then formal operational, which is adolescence into adulthood. Okay. Okay, so over the first year, developmental of body image, is usually through their sensory motor development. Okay. So infants are really sensory seeking, okay, because they're learning about their perceptions of themselves and their body based off of their senses. Okay. Their principal area of pleasure is their mouth. Think about it. They're eating with their mouth, then they're starting to put objects in their mouth to kind of figure out the world. Okay. They have to acquire object permanence, okay, in order to develop their body image. Okay, so object permanence happens usually around 9 to 10 months of age. That is when you take a toy, put it in front of them, cover it up with a blanket, and they then reach for the toy still under the blanket, and they know that that toy did not just magically disappear. Until 9 to 10 months of age, you do that with a baby, and they will just look around like, where did that object go? They don't realize that it's still there even though it's covered up. Okay. By the end of age 1, kiddos realize that they are separate from their parents. But honestly, until about 5 to 6 months of age, they still feel that they're a part of their mom. Okay. Social development, so attachment, this is important with bonding, early bonding, okay? It's imperative for attachment to happen, for them to progress socially, to develop the way that they should, okay? So early bonding, things like kangaroo care, so chest to chest, things like that are really helpful for attachment. Chest to chest, even with dads, are really great for babies, okay, skin to skin. Separation anxiety, that usually starts somewhere between 4 and 8 months of age when, like I said, they realize that they are separate from you, okay? Stranger danger, or kind of weary of strangers or not wanting to go to other people, usually happens between 6 to 9 months, and it's going to be the worst about 9 months. And then it gets better for a while, and then it kind of starts again around 16 to 18 months of age. Okay. Language development, obviously that's a part of social development. So the more reading you can do to babies, interacting with other children is really helpful, and talking with them really encourages language development. Also, these babies, as you're playing with them, that really helps the social piece of development as well. Okay. Questions on infants? No? Okay, we're going to move on to toddlers. Chapter 32. So toddlers, this is going to be 12 months. So 1 year of age until 3 years of age is going to be your toddler period, okay? There is a huge, intense period of them exploring their environment, okay? There's a lot of temper tantrums that happen during this time, obstinacy, so they don't want to do what you ask them to do. They're really negative. They're all about themselves. Okay. Okay. Jerry Seinfeld said having a toddler is like a 2-year-old without a blender without a lid. So they're very quick to anger and have that temper tantrum. Okay. So your weight gain is going to slow during toddlerhood. About 4 to 6 pounds a year is what toddlers should gain. Okay. Birth weight should be tripled by 2.5 years of age. Height should increase about 3 years or 3 inches per year. Now think about this. This is crazy. At age 2, that child is half of their adult height on average. So I don't know if you guys can, talk with your parents and see how tall you were in inches at 2, and that's about half of how tall you are now. Okay. As they go through toddlerhood, their head, instead of being larger than their chest, becomes equal. Okay. Their growth is more step-like rather than, a straight line. Okay. They're going to have longer legs than their trunk. Most physiological symptoms are pretty mature by toddlerhood. But obviously by the end of toddlerhood, everything should be mature. Okay. So there's some continued maturation that goes on through toddlerhood, but most all kiddos after a year of age, their body systems are functioning pretty well. Okay. Now, one that kind of lags behind is the ability to control their elimination. So control their bowel and bladder elimination. That typically is physiologically able to be done about 1.5 years. If parents are telling you babies are potty trained at 15 months, they're not really physiologically able to do that. So what's happening is the parents just taking them to the bathroom a lot. Okay. And they just happen to go pee on the potty every time they take them. Okay. As far as elimination goes, you have to think about, you can kind of use them being dry for 2 hours, being about age 2, and then waking up more often dry at night are kind of some indicators that they're interested in and could potentially physiologically be potty trained. Okay. This is a common time period for them to be getting a lot of illnesses. Think about it. They're in daycare. They're exposed to all the gunk from daycare. Most all kids are in daycare. So usually ear infections, viral upper respiratory infections, so coughs and colds, snots, and sore throats are the most common. Okay. So continued fine and gross motor development. So improving coordination, that usually happens between age 2 to 3. So and improved dexterity, that's usually between 12 to 15 months. And then usually by 1.5 years, they're throwing the ball, or 18 months. Visual acuity, 20 to 40 is okay for toddlers. So up to age 3, 20 to 40 is okay. After age 3, that visual acuity should be improving. Depth perception, kids still don't have great depth perception. So this is where you see the falls and, kind of lack of motor coordination being a danger. Okay. Hearing, smell, taste, touch, those all continue to develop. In toddlerhood, a lot of times you'll see them become picky eaters all of a sudden. So they were really great eaters and not refusing to try new foods, and now all of a sudden they're starting to refuse things that even they used to like. So continue to encourage parents to push through that and not make them separate meals. Okay. They're using all of their senses to explore and interact with their development and their environment. Okay. Now, Erickson's. The Erickson stage for toddlers is autonomy versus shame and doubt. So they're wanting to do things themselves. Think of a toddler, a 2-year-old, a 3-year-old. What are they saying all the time? Me, me, I do it, right? They say that all the time. They want to do it themselves. And if they're not allowed to have some autonomy in doing what they can do for themselves, then you will see those kiddos feel really shameful, and then they start doubting themselves. Okay. Rituals. So routine really gives these toddlers a good sense of comfort and safety. Okay. Their id, their ego, their super ego, their consciousness, it's all about them. Okay. So they don't necessarily care how what they do is going to affect you. Okay. And what's most toddlers' favorite words other than me? No. Yep, that's their other favorite word. Me, mine, no. That's toddlers. Okay. Okay, Piaget. So sensory motor initially, right? Because I said sensory motor goes until what age? Sensory motor goes until 24 months or age 2. Okay. And then they become, after age 2, they enter that pre-operational phase for Piaget's cognitive development. Okay. So by 13 to 18 months, they're into that tertiary circulatory reactions. So they are learning spatial relationships. They've learned object permanence. They're learning some cause and causal relationships. So if you do this, then this happens. Okay. They're identifying themselves separate from objects. Okay. So 13 to 18-month-olds, during the tertiary circular reactions, what you can see happen is they will start to identify, okay, if this cup that's really tall is full and this cup that's wider is also full, they'll start to understand that they have still the same amount of water in each. Okay, so that's kind of where they're learning the spatial relationships. Early symbolic thought, that happens 19 months, so a year and a half to 2 years of age. That's where they're imitating, typical traditional domestic kind of roles in the family. So if mom or dad are the ones who typically cook dinner, if they're a girl, then they're probably going to mimic what their mom is doing in the home. And then if they're a boy, they're going to mimic more what their dad is doing in the home. Okay. Concept of time, they still don't really understand time. Okay. You're also going to get a lot of imitations of your behaviors in this early symbolic thought, which is the 6th stage of the sensory motor period. Okay. So the final 2 stages of sensory motor stage are tertiary circular reactions and early symbolic thought. That is what's going to be happening during toddlerhood before they progress to pre-operational phase of Piaget development. Okay. It's kind of just saying it in a different way. Okay. So this is going further. So Erickson's autonomy would be them feeling safe, them building patience, them being encouraged. Okay. They're able then to be able to handle different problems. Okay. If they have parents that are, helicopter parents and don't let them do a task that they're capable of, or, they're worried that that kiddo is going to get hurt if they do that task, then you'll see that they'll start doubting themselves and they'll start refusing to do new things that, they are able to physically do, but they don't even want to attempt to do those things. Okay. And this is showing those 3 first stages of the sensory motor phase. So, like I said, they happen to get their thumb in their mouth. They think, oh, that was cool. And then, or, that made me happy. And then it might take, another few times of them just happening to get their thumb in their mouth before then they realize, hey, I can put my thumb in my mouth and then that makes me happy or content. Okay, so that's primary circular. Secondary circular is they're intentionally repeating things to get someone's attention. So they look at the rattle, then they grab for the rattle, they get the rattle, they realize they can shake it, and the mom or the dad or sibling looks at that kiddo when they shake it. So then they get a response. Okay. Tertiary circulatory reactions is trial and error. They accidentally throw their cup off. Mom or dad or brother or sister pick it up for them, put it back on their tray, and then they do it again to see if, parents will do that again. And then it turns into kind of a game, right? It seems like to parents, but that's tertiary circular reactions. And that comes later, 12 to 18 months. Okay, developing gender identity. So that usually happens by 2 years of age, okay? Gender roles are starting to be understood by toddlers. They begin playing house. They are usually going to mimic, what they see in their home environment as far as gender roles, okay? Exploration with genitalia is common in toddlerhood. They're going through potty training, and so touching their private areas, it's normal. It's a normal part of development. So just letting parents know that that's okay. And it's what every toddler usually goes through. And just encouraging parents to talk with them about, areas that they are okay to explore their genitalia and what is not okay to be, in an area like, at school, it's probably not the best area for them to be exploring their genitalia. So talking with them about that. Separation, they understand the difference from their mom and their dad and others in their family. And then they're also then trying to individualize themselves. They're trying to kind of figure out who they are going to be. Okay. Language development, that by age 1, they should be using 1-word sentences. Okay. By age 2, they should be using at least 2-word sentences, if not more. Okay. Early on, they should understand more than what they're able to say. And then that should have kind of transitioned to where they comprehend, but they are also having, increased word development as well themselves. Okay. Toddlers, it's important for them to be able to feed themselves, dress themselves, play, undress themselves. Allowing them to do that, like I said, helps them to become more autonomous, and then them to not potentially be having a lot of shame and doubt in themselves. Okay. It can make it more difficult if you have a strong-willed or a really determined toddler. It's more likely that these toddlers will have more temper tantrums. Okay. And that kind of varies based on the toddler's temperament anyways. Okay. Toddlers towards the end of toddlerhood, towards closer to age 3, they start to recognize others' feelings, and they'll be concerned, if mom or dad looks sad or brother or sister looks sad and are crying, then toddlers will start to recognize that. Play is where a lot of their physical and psychosocial development will begin. Okay. They're interacting with others. Those interactions become more important as they grow. Okay. Making sure that these kids are playing with toys that are developmentally appropriate. Okay. That's going to be the biggest thing, is making sure whatever this kiddo is doing is appropriate for their development. Okay. Not necessarily their age, but their own cognitive and physical development. Okay. Parallel play is where kids are playing two separate games, just sitting next to each other, not interacting with each other at all. Okay. Tactile play is using some kind of sensory feeling, sensory motor kind of play. Okay. Imitation is they're imitating, each other or an adult. They're dressing up like their mom who's a nurse to take care of a kiddo. Okay. That's imitation play. Okay, concerns related to growth and development. Like I said, the 3 signs of readiness: age 2, dry for 2 hours, waking up dry in the mornings. Okay. Sibling rivalry is always a struggle. So you'll see more temper tantrums, you'll see hitting, kicking, potentially, all kinds of things. If siblings are closer in age, then, if one goes potty by themselves, then, the other will want to go potty by themselves. Okay, so kind of some competition there is pretty natural. Temper tantrums, they can happen whenever, but they're more common at bedtime because that kiddo is trying to delay going to bed usually. Okay. Negativism, which we already talked about, this is that no, me do. They're trying to be autonomous. They want to do things themselves. And then regression can happen potentially at any time during stress. So a new baby comes home, the kiddo who is 3 had been totally potty trained, daytime, nighttime, pee and poop, and then all of a sudden they're having accidents. So that's a pretty normal situation with regression of behavior. Okay. Optimizing their nutrition. So a lot of times they go through physiological anorexia. So toddlers, they don't really like to sit down and have a full meal. Okay. They are busybodies and they have other things better to do in their opinions than sit down and eat a meal. So these kids will start refusing to eat. They become really picky. A lot of times they don't like milk, they don't like meat. So they'll be on more vegetarian kind of diets. So it's really important for parents to be continuing to offer the meal that they've made, and making sure that these kiddos are getting protein. Okay. Whole milk, that starts after age 1, as well as then honey can be done after age 1, like we talked about. Okay. Sleep inactivity, sleep problems can start to be a struggle in toddlerhood. You can see things like, night terrors start to happen in toddlerhood. Usually it's because those kiddos are iron deficient. It's one of the most common reasons why kids have night terrors. But pretty normal time frame is around 2 for that to start happening. Dental health, so regular dental exams from age 1 on every 6 months is what's recommended. When they're about 6 years of age, they should start flossing. Okay. Fluoride, like I said, can start at 6 months. They need to be making sure that they're removing their plaque while they're brushing their teeth. So parents likely still need to be pretty diligent about helping them until about 6 years of age when they have really good coordination to be able to floss and brush well. Okay. Making sure that kids don't have early childhood dental caries or cavities by, not giving them a ton of sugary foods, not letting them go to bed with juice or milk, or not doing a lot of juice, period. So if they need something at night to drink, water is the option. Okay. Ingestion of injurious materials. So heavy metal poisoning, so mercury poisoning, lead poisoning. Mercury poisoning we don't see quite as much since they got rid of the mercury from thermostats. But that's still a risk potentially with some foods. like certain fish. If people are eating large amounts of that, then mercury poisoning can still be concerning. The more common heavy metal poisoning is lead. Okay. So you'll see kids routinely screened for lead poisoning starting at about 9 months of age. Okay, and then they're usually pretty routinely screened after that with at least a questionnaire. Okay. If their lead level is too high, then they have to have chelation, which is what's shown in this picture. So essentially the blood is kind of filtered out, the lead is pulled out separate, and then the blood is then recirculated. Okay. Or they're given an IV chelation to bind with that lead. Okay. A lot of times kids, if they have elevated lead, they also have low iron levels. Okay. Okay. Cosmetic products, personal care products, medications, cleaners that are at the levels where kids can climb up on the counter or open up cupboards and get into that. Foreign bodies, so they swallow pennies or batteries or all sorts of things. So getting those kids into the ER, the best thing to do first is call Poison Control Center. I encourage all parents to save the poison control phone number in their phones so that way they can call that right away. Obviously, if it's there's respiratory depression or cardiac involvement, CPR is started, something like that, those kids EMS needs to be called before poison control. Okay. But usually you call poison control as long as your kiddo's with it and awake still and breathing and all of that. And they guide you as to whether or not that kiddo needs to go into the ER or if they can just make an appointment with their provider the next day. So that's kind of the role of poison control. Assessing, have parents assessing the kiddo. You as the nurse too, when they show up to you in the ED or at school or wherever they've had this ingestion, you'll want to make sure you do a really thorough, quick assessment. Sometimes gastric decontamination, so you might have they might be given something to induce vomiting, which is kind of an old way to do it, but still done that way in some ERs, depending on certain situations. And then the biggest concern is making sure that they don't ingest this poison again. Okay, so parents need to be locking up, all of these potential risks. Motor vehicle safety. So toddlers also need to remain in their car seat restraints. So like I said, most toddlers will remain rear facing and be okay weight and height wise to remain rear facing through toddlerhood. Now some chunkier or taller toddlers, they may flip to forward facing depending on their car seat, but no matter what, they need to be forward or rear facing in a 5-point harness. This picture here, this is probably a school age kid because you can see here that they have the lat belt. Okay. Motor vehicle injuries are still one of the biggest risks for injuries for toddlers as well. Okay. Now, kids are getting into pools more often during toddlerhood. So the risk of drowning is more common. Burns, they're more curious and they're taller and more mobile, so they can pull, those hot liquids off the stove on themselves. If the pan handle is, outward where they can grab and pull that down, they're more risk for falls. Okay, because they're climbing usually. Okay. So just talking with parents about all these potential risks for injuries. Okay. Here's the different kind of car seats. You can see over time how they've changed. And then, now our car seats have this clip and then an extra clip as well. Okay. So not every car seat is the exact same for installation. You have to follow that specific car seat manual. If parents don't have the manual, then a lot of times they can go on the National Highway Traffic and Safety Administration website and look it up there. Or NHTSA is the other term for that. Usually car seats, they do expire, usually 6 to 10 years from the date of manufacturing. I wish that they would all go to, 10 years across the board, but that hasn't happened yet. Babies need to be rear facing in the back seat until 2 years of age. Now, that's at least 2 years of age. Some states, like the state of Iowa, we don't have really great car seat laws. So our car seat law is at age 1 and 20 pounds. Those kids can be flipped forward facing, which is very concerning to me. But like I said, the best thing safety wise for you to talk to parents about is having them rear facing for the maximum height and weight of their car seat. Most car seats can be rear facing. Kids can be rear facing up to 40 pounds. Okay. Okay. Gross motor refinement of coordination occurs at what age? They're refining those coordination skills. When does that usually happen by? Guys are so quiet. Yes. Number 1 is B. Between ages 2 and 3, they should have those refined coordination skills. Okay. Fine motor improves. Manual dexterity improves at what age? You can unmute, it's okay. Improved manual dexterity. So improved grasping.
C.
Yes.
C.
Yes. 12 to 15 months. And then by process of elimination, number 3, throwing a ball occurs by 18 months. Okay. Good. All right. Questions on toddlers? No? Okay. We're going to move on to preschoolers then. Okay. So preschool period is from age 3 to age 5. Okay. This is, they're prepping to go to school, right? They're in preschool, they're getting ready to go to school, they're maybe in daycare doing a little preschool kind of activities, at age 3. But then between 4 and 5, they're really starting preschool. Okay. It's really beneficial to read to every kiddo every day, even as infants. Okay. But continuing that through preschool really helps their overall language development and just social development. Okay. By reading also, it already kind of gears their attitude to be more positive to learning in the school environment. Okay. They're learning how to interact with other children, how to share, how to talk to other children, how to start playing with other children. Okay. They're starting to have increased attention spans and memory. Okay. They're getting used to the more prolonged separation that has to happen when they get into school age time. Okay. Their biological development, so physical growth is going to grow and it's going to stabilize. So kids during preschool age, they're gaining about 5 pounds a year. Okay. About 2.5 to 3 inches a year. So a little slowdown on height increase. Okay. Body systems are mature and then they continue to stabilize. Now, the body systems will adjust based on stress or change. So if there's a lot of stress going on in that kiddo's life, those body systems are going to adjust. Okay. Gross motor skills, they're going to go from walking to running to climbing to jumping. And those are all really well established gross motor skills by 3 to 5 years of age. Fine motor, they're continuing to refine that hand-eye coordination. okay? And they're getting more skillful. They should be dressing themselves. They should be undressing themselves. They're starting to draw and color, and it's getting more organized as they get closer to age 5. Psychosocial development, so their Erikson stage is initiative versus guilt, okay? So their chief goal is taking initiative, being able to do things themselves, learning wrong from right, okay? If they are unable to do this task, then they'll have feelings of guilt, they might be anxious, they might feel shameful, okay? Okay, and they're starting to develop a conscience. Like I said, they're learning kind of moral wrong from right. Cognitive development. So, this is Piaget, okay? So like I said, they're getting ready for school, they're getting ready for their scholastic reading or learning to start, okay? They're getting ready for being able to sit through kindergarten, okay? This all should be the goal by age 5 to 6. Like I said, continuing to read to them every day, getting them involved in other activities with other children so they are already socialized before they get into kindergarten is really helpful. Pre-operational phase, this is Piaget, so they're in, this is from age 2 to 3 years, okay? Preconceptual phase, this is ages 2 to 4. Initiative thought phase is 4 to 7. Okay, so they are starting to shift from being all about themselves to being aware of others socially. Okay, they might be able to start to see others' viewpoints. And this shift occurs from the preconceptual phase to the initiative thought phase. Language is continuing to develop. Okay, they start to kind of have some idea of concept of time. So you can tell them after we eat breakfast is when we go outside, and they can understand that. They're not going to tell you the exact time on the clock of things, okay? Or, when we wake up in the morning is when we go to school after we go to bed at night. They can kind of understand concept of time in that way. Magical thinking. So this is where they're really imaginative, okay? Moral development, Kohlberg. So they're in the pre-conventional, they're pre-moral level of Kohlberg development, okay? So they're understanding the basic level of moral judgment, punishment, and obedience, okay? So if they do something wrong, then they get a punishment, but if they do something right, then they might get a reward, okay? Very concrete justice and fairness, okay? Very concrete, no abstract at all. They're increasing, kind of wanting to, what their appearances look like. They're aware of their racial identity and differences in appearance than other students their age, okay? They still don't have great body boundaries, okay? So they feel if they have a cut in their skin, all their blood's gonna leak out, or, things like if they, fall down and scrape their leg, their blood's gonna come out, or if they get a little cut, their insides are gonna fall out. Really kind of eccentric fears, but this is a pretty common thing, okay? Spiritual development, so a knowledge of faith and religion can be learned from others in the family that have religious practices, okay? So if these kids are going to church with their parents, they can start to have kind of some basic knowledge of faith and religion, okay? They might, if they're sick or if someone in their family is sick, interpret that as, they did something bad, so they got sick, okay? They start to continue to develop that sense of consciousness, and it starts to kind of link with their spiritual development. Okay, development of sexuality. So this is where, so in preschool age groups, so 3 to 5 years of age, this is where you see most commonly that they have a really strong attachment to the opposite sex parents. So girls are really attached to their dads, and moms are really or boys are really more attached at this age to their moms, but they identify with the same sex parent. So girls will want to, do similar things to what their mom is doing, but they really like to be more attached to dad. Okay. During preschool time, usually modesty, they become more modest. So they're going to want to, dress themselves with doors shut and things like that. Okay. Sexual exploration becomes more pronounced. They might start to have questions about how babies are born, closer to age 5 usually. And then, like I said, sexual exploration in the form of masturbation is more common in this kind of later age group. And once again, just talking with them about, places that's okay to masturbate versus not. Okay. Social development. So they realize that they are separate from others. Okay. So they are their own person. They've realized that now. Stranger anxiety and fear of others and separation from parents are usually overcome by 3 to 5 years of age. Okay. Parental boundaries and guidance are still very much needed. They still like to know the routine. They still like to know expectations from parents, and that makes them feel more secure. This is where you can start to see like sleeping with a stuffed animal or a blanket that can make them feel more secure. Okay. Play therapy, if kids are having a lot of anxieties or fears or a lot of fantasy kind of thinking, play therapy can help all of that. Language is more sophisticated, so they're speaking, in longer sentences. And they're seeing, a lot more vocabulary. So there's a huge increase in vocabulary between ages 2 to 5, and the complexity of that vocabulary then continues to increase as well during that time frame. Personal social, so like I said, ritualistic and the negativism, so the me do all by myself, and knows that starts to improve usually between 3 to 5 years of age. Kids can dress themselves. They really want to make parents happy. So they a lot of times will start to care for themselves to try to make their parents happy. Okay. But the child will a lot of times still try to kind of test the boundaries. Okay, so making sure that parents are sticking to the boundaries and the rules and the expectations. Otherwise, those kids will figure out what exactly they can do to test the boundary, and they will do that every time. Okay. So associative play, this is group play without rules. So they're playing together. They don't have a common goal. Okay. Imaginative play is where they're playing with imaginary friends. Okay. Imitative play is they're like this little girl here. She's imitating being a nurse, right? She's listening to her little stuffed animal's heart. Dramatic play is similar to that. And mutual play is they're starting to play together. Fears in the 3 to 5 year old preschool age, dark is probably the most popular. Being left alone, fear of large dogs, ghosts. They might fear that, their private parts. So like boys might fear that their penis gets chopped off. I mean, really drastic kind of crazy fears that seem really irrational to us as adults. Okay. They might see you as the nurse and start all of a sudden getting really anxious that you're going to give them a shot every time they see you. Okay. As far as education and fears, this is kind of another, way to talk about sex education with 3 to 5 year olds. Like I said, Masturbation becomes more common around age 4. So making sure you're talking with these kiddos about this being done in private is okay, but at daycare is not okay. Making sure you're using correct anatomical words, okay? And be honest with kids. Speech problems, usually the most critical period of speech development is between age 2 to 4. And if they are not progressing with speech, and they're having a hard time mastering their sensory motor integration, so interacting with those senses and their environment, then a lot of times you'll see stuttering and stammering becoming more common. If you're seeing stuttering and stammering continuing after age 5, then usually speech is necessary. Okay. Early detection of speech delays are crucial. So if you have a kiddo with speech delay, they need to be in speech as soon as possible and have their hearing checked. Okay. Sleep inactivity, usually nightmares, sleep terrors, consistency with bedtime rituals can be really helpful in getting these kids to have better sleep through the night. Okay. And then you want to make sure that you're encouraging these parents to have their kiddo doing some sort of like decompressing kind of slow down activity before bed, instead of letting their kids watch, TV until the second the TV gets shut off and they have to go to bed for school. Injury prevention. So bicycle helmets, if they're gonna rollerblade or roller skate, they need the elbow pads, the knee pads, wrist guards, bicycle helmets, all of that. Okay. During 3 to 5 years of age, the risk for pedestrian motor vehicle accidents is more risky because they're doing things like riding their bikes and playing outside. So it's more likely then at that point that they are pedestrian that gets hit by a motor vehicle. Continuing to talk about safety and potential hazards such as swimming and life jackets and all of that. Okay. Anticipatory guidance for preschool age kids. Like I said, its focus is more to getting them ready for education. Okay. Kids are going to be starting to question what parents have taught them, especially as they get into the school setting where other peers are maybe acting differently than they are. Okay. Communicable diseases, we kind of already talked about those vaccines, but obviously with declining immunization rates, your risks have really drastically increased. Okay. So making sure you as a nurse are getting a good assessment, a good history, making sure that they're all up to date on their vaccines, asking if they've been exposed to any illnesses. Okay. Primary prevention of most diseases is vaccination or immunization. Okay. And then of course, hand washing, infection control policies, and reducing the risk of cross-contamination with organisms. That all helps to prevent the spread of the disease. Communicable diseases, okay, conjunctivitis, so pink eye. This is one of the most common, eye gunk bacteria cause in 3 to 5 year olds. Okay, so warm, moist compresses. They need antibiotic eye drops. Okay, making sure that those secretions are removed. It is infectious until they've been on eye drops for 24 hours. Okay, so preventing them from rubbing their eyes nonstop and then not washing their hands and going and infecting others. Giardia, so parasite. Giardia is a GI parasite, and enterobiasis or pinworms is also another GI parasite that kids can get. So Giardia is usually diarrhea. It's excessive diarrhea. So to manage that, sometimes they need an antiparasitic But usually they can kind of flush it out with having diarrhea that lasts about a week or so. But making sure that they're staying very hydrated with Giardia is really important. Okay. So those kids might need to be hospitalized if they have really significant diarrhea and they're not replacing their fluid loss. Pinworms, that there's over-the-counter antiparasitic medication called Reese's pinworm treatment that they are given, and that essentially kills the pinworms. They get pinworms usually from digging in the dirt, having the dirt under their nails, and then kind of chewing or itching their bottom. You'll notice them doing that a lot too. To diagnose pinworms, you actually have parents take a piece of clear Scotch tape and put it over their anus entrance before bed. And then what will happen is those pinworms they usually then are stuck to the Scotch tape in the morning. And that's how you can diagnose pinworms. Okay. And like I said, an antiparasitic is needed for that. Also, of course, child maltreatment or abuse is always a concern in childhood. It seems to be a little bit more common in this 3 to 5 year old age group, but can also be something that happens at any point in time during a child's life. So there's different types of neglect. Physical neglect is deprivation of food, clothing, shelter, basic needs, medical care, or education. Emotional neglect is lack of affection or attention. Okay. We're just kind of dismissed, not interacted with. Emotional abuse is then also kind of a subpart of emotional neglect. And then physiological maltreatment, which is the destruction or impairment of that child's self-esteem. So you're really demeaning to them, and you're really hard on them physiologically. Okay, so those are the types of neglect. Physical abuse. So the most common cause of physical abuse usually is head trauma. I would say probably the most common is head trauma. So AHT is abusive head trauma. So you can kind of just look at the type of injury. If it's a kiddo who's not been crawling around, a lot, they're not going to have any crazy broken femurs or, really major head injury because they're not really that mobile. So just kind of see what the story is from parents, what the story is from others, and then kind of go from there on assessing whether or not it seems to be an abuse case. Munchausen's by proxy is it's a form of medical child abuse where the parent continues to say that they have something wrong with them, but nothing is ever found by the providers. And a lot of times you can see Munchausen's by proxy progress to that parent or caregiver doing things to that child to make them actually ill, like injecting insulin or things like that. Okay. Obviously, parental characteristics, if parents are really rough or they've had abuse themselves, they're more at risk for then abusing their children. The characteristics of the child, so if they have a really difficult, high needs child, that's more at risk for that child being abused. And then of course their environmental characteristics, so if they're in a poor kind of environment, then they're also more at risk for child maltreatment. So physical assessment is really important in kids who are being physically abused, but also checking for neglect and emotional abuse and potential sexual abuse. This is going to be a multiple care coordination. Okay, so you'll have to support the child from any further abuse. If it happened at the daycare, that family's going to really need a lot of support. Planning for discharge after a hospitalization or after them coming to your clinic. or the ER for potential childhood maltreatment. And then the end goal is then to obviously prevent abuse in all cases. Okay. Parents tell the nurse that their 3-year-old daughter and a male cousin of the same age were inspecting each other in the bathroom closely, or inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? What's the most likely response?
Is it B?
So, yes. So you don't want to condone or condemn the curiosity, but also you don't want to encourage it, right? So you want to talk with them both about, yes, male and female, they have different parts. But obviously explain that our parts are private. Okay. But yes, B is correct. Okay. So we have, let's see, 4 minutes left for the Kahoots. Stop sharing here. Now the Kahoot, the big Kahoot is on the week 2 announcement. If you guys want me to put the separate Kahoots, I can put that as well under the week 2 announcement, but it's all the same material. It's just separated. So totally up to you.
Separate.
You'd like the separate ones on there as well? Okay, perfect. All right, I'm just waiting for this Kahoot to load. Remember, we have to stay until 4:20 for full attendance. And since we didn't take a break, we'll be done then at 4:20. Hannah, can you put your camera back on, please? And make sure you all are staying on camera. Otherwise, you'll lose attendance time.
I had to go to the bathroom really quick.
Yep, that's fine. Just turn your camera back on. And if that happens, just send me a quick message that you're going to the bathroom.
Okay.
Okay. Alrighty, let me share my screen. Like I said, it'll be just quick here. Alrighty, you guys should be able to see that. We'll do like 2 or 3 questions. And we'll be done. Give you guys like 30 more seconds to hop on here. And we'll get started. Okay, we'll just go ahead and get started. If you guys didn't get logged in, just, pick based off of what you would pick. Okay, multiple select. Types of play considered to be sensory pleasure play. Playing in sand, finger painting, playing checkers, playing with mashed potatoes with fingers. Which would be considered sensory pleasure play? And it was a multiple select. Yes, perfect. Good job. So playing in sand, finger painting, playing with mashed potatoes with their fingers, anything that, you're interacting with taste, touch, feel, listening, your senses. Okay. Good. Nurse noticed patches in the mouth of an infant that cannot be removed with a tongue blade. What is your intervention? Switch formula, observe for sucking and swallowing, assess respirations, discuss the need for medication to treat the patches. Good. So what are the patches in the mouth that can't be removed with tongue blade?
Thrush.
Thrush.
Good. And then we talked about what we treat it with, remember?
Nystatin.
Nice.
Yep. Perfect. Good. All right, we'll do one more question. What type of play is considered to be cooperative play? Playing a sandcastle by themselves, sharing toys with another child, playing checkers, or driving a RC car? Okay, so cooperative play, remember, is you are playing with another child with the same goal in mind. So you're playing Legos and you're building the exact same thing together. So you're building a castle together. You're playing checkers and you both want to win. Okay, so that's cooperative play. Now, associative play is you're playing together, but you have two separate end goals. So say you're doing Legos and you don't want to build the same thing. Okay. Does that make sense?
I have a quick question. So
Yeah.
if that would have said sharing a toy, meaning a single toy with another child, then that would be considered cooperative?
So they would have to be sharing the toy and also wanting to play the same thing with the toy together.
Okay.
Does that make
Gotcha.
sense?
Gotcha.
So like
Thank you.
cooperative play is more like game kind of play. So like they both want to win, or they both want to build a tower or build a castle. So like they're playing together for the same end goal. Where associative play is they might be playing together, but they have two separate end goals for themselves. Make sense?
Yes, ma'am.
Okay. Alrighty. Well, it's 4:21. If anyone has any questions, you guys can stay on here and ask those. I'm pretty good about answering emails for those of you that joined me late. That's probably the easiest way to do it, is just either message me through Canvas or email me. That's the easiest way to get a hold of me. What else? Any other questions? No? No? Okay, make sure you guys are letting me know what you would like to do for your projects. I know it's due week 8, but it is easier if I okay it and you know, you can start working on it earlier that way. Okay. So I know there have been a couple people that have let me know what they want to do, and I usually just reply back, yep, you can do that topic. Okay. So if you guys want to start doing that, that's totally okay. Okay. All right. Anything else?
The ones that just joined, where will we find out information about the projects?
So it will be under, let's see, it'll be under the week 8 module, but there's a list of the potential topics here. I'll tell you exactly where it is. Let me see. Also, okay, I'm not gonna say your name correctly. Lucencio, is she still here? No, she's not here. Okay. Never mind. Okay. Let me tell you exactly where it's at with the list.